The first one is called a quad set. So as your legs are out in front of you, you can rest your hands down. What you want to do is press the back of your knee down into the mat. Press down. And what that does is it contracts the quadricep muscles. And release. 5-second hold down and then release. Then for straight leg raise, you can bend your opposite knee, flex your foot, engage your core, and then lift your leg up and down, which I typically like to teach a straight leg raise lying down. So you would be here where your hip angle is straight. Brace your core, tuck, flex, and then lift your leg up and down to the height of your opposite knee. So this will help strengthen the front thigh and the front hip. Straight leg raise with a quad set, also known as terminal knee extension. So your knee stays straight the whole time. You'll know your quad is shutting off if your knee starts to bend and your leg is lagging. So now the distal part of my quad down here, distal versus proximal, the distal part is not activating as well. You really want to try to get that active the whole time. And then after you can complete 3 sets of 10 on both sides and you're feeling work, but you want more challenge, that's when you would add resistance. This is 2.5 pounds, just a little cuff weight. You can put that around your ankle and you can double it up, or some of the weights that are sold in the stores and on Amazon, you could actually put like 1/2 pound, 2 pounds, 3 pounds, up to 5 pounds on each one. Tuck the tailbone under, brace your core abdominals, flex your foot, lock your knee, or at least get that terminal knee extension, not hyperextension. And then again, you're gonna lift up and lower down with control, 3 sets of 10. I can definitely feel a difference just with 2.5 pound change. And so I'm working on really isolating and concentrating on strengthening the front thigh, the front quadricep. Okay, so the same thing goes for strengthening the entire knee. You want to change position of your thigh. So we got front thigh or anterior. Now we're going to get the inner thigh. So I'm going to move this leg out of the way. It can come in the front or behind. And then same thing, you want to do terminal knee extension or straight knee. Brace your core and then lift your leg up and down off of the mat into hip adduction. And this will strengthen the inner thigh and VMO, vastus medialis oblique muscle. And that gets the inside or the medial side of your knee. Once again, you're going to do 3 sets of 10. You should feel some fatigue and a little bit of muscle burning, and then master that. And then you can change the resistance with either more or less weight. 3 sets of 10 for hip adduction. Now, this is strengthening your knee, but it's also really strengthening your hip joint. And then for the posterior knee, same thing. You're going to tuck your tailbone under, brace your core, lock your knee, and lift up and down into hip extension so that you can get your hamstring. Now I'm going to point my toes just so I can get my foot out of the way. As I lift and lower, I don't want to bend my knee and let it lag. I'm trying to keep it super straight the whole time. And then also, hamstring curl while I'm here. It's going to be too easy though. So just doing a hamstring curl up and down, it's going to be pretty easy unless you've had like a knee replacement or you're just out of surgery for an ACL repair or something like that. But this hamstring curl, you can do it with a flexed or pointed foot. Now I'm strengthening the distal or the bottom part of my hamstring closer to my knee joint. But when my leg is straight, I'm strengthening more the proximal or the hip side of my hamstring. Okay, 3 sets of 10. And then last but not least, hip abduction. So you can bend the bottom knee for support. Top leg is straight. You want to engage your core abdominals so you don't tweak your back. Flex your foot and then lift your leg up and down parallel with the ground. And this will strengthen the vastus, lateralis, the outer thigh. And then you can do this with resistance, without resistance, 3 sets of 10. I feel it more on my outer hip because my knee is straight. You could also do like a short lever hip abduction, but really the best way to strengthen your hip and knee on the lateral outer side is with a straight leg raise. Okay, so that's 3 sets of 10 also. So for open kinetic chain, you're going to be seated, and then you're going to straighten your leg up and down into full terminal knee extension. This helps to isolate your distal quadricep now. This is really targeting your knee joint. So this weight is only 2.5 pounds. It's not a whole lot of resistance. I go to the gym and I hop on one of those machines so that I can just adjust the weight to 20, 30, 40, 50, 60 pounds individually. And then I place that padding in front of my shin. And then I just straighten the leg up and down, and I can feel my quadricep burning and just really getting that challenge of strength. And I do 3 sets of 10 or 3 sets of 12, as long as I don't feel a lot of pressure in my kneecap. And that helps to strengthen your quadriceps very effectively so that you can start getting your knee pain under control. Once your knee can tolerate open kinetic chain strengthening, then I introduce closed kinetic chain strengthening, which would be squats and lunges. So with closed kinetic strengthening, you would open your feet about hip width apart, engage your core abdominals, sit back into an imaginary chair, not letting your knees go past the toes. Not that it's terrible for your knees to go past your toes, but when you're doing a squat, the more you shift forward, so I'm lifting my chest and I'm shifting my knees forward, the more compression and force production happens in the kneecaps. So instead, you want to shift your butt back so your knees are more behind your toes, and then press up by pushing your feet into the ground and then rise up all the way. Sit back, press your feet down into the ground to rise up. So this one you're going to do 2 sets of 10. And again, this is closed kinetic chain. This is more of an advanced strengthening technique for your knee joints. If you start to feel pain in your kneecaps or you feel some instability, then there's a couple of things you can do to make that pain lessen. You would actually place a ball or a yoga block between your knees. So something like this is a little squishy Pilates ball. So you could squeeze it, plant your feet down, sit back, squat. So now I'm engaging my adductors or my inner thigh muscles as I'm working on my squats. And again, this is strengthening the quadriceps. As I press up, it strengthens my glutes and my hamstrings. But you don't want to feel compression and pain through your kneecaps or your knee joints. If you do, it's not the appropriate exercise for you. Another option is to place a band around your thighs. And now I'm pressing my legs out so I can get my abductor, outer hips, in control as I squat, sit back, and press back up. As I squat, sit back, I'm actually pushing my knees apart and I'm grounding my feet down into the mat. Sit back, pressing your knees apart, press your legs right back up. So if you do this 2 sets of 10, you're going to concentrate on activating quad control and creating symmetry. Now remember what I said about overpronation. If you're wearing shoes, your feet are going like this. Every time you squat down, your knees start to come together. That's contributing to uneven forces into your kneecaps. So you have to have your feet grounded, big toe, pinky toe, and the backs of your heels. As you press the knees out, you're trying to maintain this straight alignment. So now for lunges, I'm going to place my feet parallel on the mat, hands to hips, engage my core, sit back, knees stay behind the toes, step back with one foot, lift the trunk torso upright, and then I'm trying to stretch the mat between my 2 feet. This knee in the front should not be translating towards the toes. It ideally should be perpendicular with the mat. And then you're going to dip down and press up, dip down and press up. 2 sets of 10, making sure that your knee does not translate towards the toes or past them. And so as I'm moving up and down, I'm also tractioning my feet apart. That makes me kick on my glutes and hamstrings and my quadriceps way more to create stability. And then step forward, switch sides, step back, dip down, keep your knee behind the toes. Same thing. I'm pressing my feet apart, activating my glutes, hamstrings in the back, and my quadriceps in the front far more. If you start to feel a sharp pain or sensation of pretty obvious discomfort, then you should not do these lunges until you're able to achieve it without pain. I would go back to more open kinetic chain strengthening for your knees. Okay, and then release, kind of shake that out.